Hi guys, give us just a second. I'm just getting everything set up over here. Great. So guys, today we're going to be talking to Dr. Brian Nguyen of the USC Center for... Here he is.
All right, hello.
You. How are you?
Doing great, thanks. Thanks for having me.
Yeah, absolutely. Okay, y'all, so today we are talking male contraception, and we have Dr. Brian Nguyen, and I'm going to give a little intro into Dr. Brian. He is an OBGYN and a leader in the space of male birth control research. In addition to his as an assistant director for the Fellowship of Family Planning and assistant professor at USC's Department of Clinical Obstetrics and Gynecology, he is the founder and director of Emerge, a research lab aimed at demonstrating how addressing men's reproductive health can improve the global care of women. So that's a mouthful to say that this guy is really at the forefront of male contraception and he knows what he's talking about. So my first question for you, Brian, is what is your role within the Center for Male Contraceptive Research and Development?
Wow, that's a great introduction. Thank you very much for having me again. And I'm really pleased to share all I know about male contraception with this group. I think the more that people know about male contraception, the more we can begin to make demands, right? I'll always tell people that the amount of research that has gone into male contraception is quite a bit, right? We've been actually researching male contraception for as long as we have been researching female contraception. However, the disproportionately small amount of funding that male contraception has received has really impacted our lack of progress, right? That's why you don't really hear about it. So in terms of my work, right? So I am a sub-investigator for the National Institutes of Health. So the point there, right, is that the federal government is funding this research, not some large pharmaceutical company. I don't get any kickbacks. So this is a unbiased talk here about research that I'm personally passionate about. So as a sub-investigator for these trials, I help to recruit individuals, and I also act as the primary OBGYN for these trials too. Any birth control trial, right, has the risk of pregnancy, and so I'm the OBGYN who talks about that risk of pregnancy when couples join these trials for male contraception. So that's kind of my job. Something kind of interesting that most people don't know, or actually something interesting that people say about male contraception is, well, why should we support this when it's the female partner who gets pregnant if for some reason something fails, right? What's interesting about male contraception is that we can test men's sperm to see if it's working before we say, okay, go ahead. And that's not a feature that we have with female contraception. So yeah, there you go.
That's great. Okay, so you've talked about the fact that you're researching male contraception. Can you tell us about what is currently on the market and what you guys are developing?
Totally. So in short, what's on the market is nothing. Right now, the only options that men have for preventing an unintended pregnancy are, vasectomy, condoms, withdrawal, and having a healthy conversation with their female partners. Now, that being said, in terms of the methods that we are working on, there are actually a lot of methods. And when you're thinking about male contraception, we really kind of divide it into both non-hormonal and hormonal methods. So non-hormonal methods might be things like injections that go into the vas deferens, which is the tube that carries sperm from the testicles out, or also methods that can kind of immobilize sperm in the vagina. But what we're most excited about are hormonal methods, and the reason why we're really excited about hormonal methods, and I'm going to leave room for questions about people's concerns about hormonal methods. But the reason why we're most excited about it is because we have the most experience with that, right? We have over 50 years of experience with female hormonal contraception. We know that the way that hormonal contraception works is that you're basically shutting down switches, right? It's a system of switches. You're not impacting any of the machinery or any of the output of that machinery, and so therefore, when you stop hormonal contraception, you have good certainty that it's reversible and that everything will go back to normal. So that's the reason why we're excited about hormonal contraception. In terms of more specifics about what we're developing, the group that I work with, which is called the Lundquist Institute, we're located in Los Angeles, specifically Torrance, California. We've been looking on, pills, implants, injectables, but the most recent method is the topical gel. It's a topical gel that men apply to their shoulders on a daily basis. It's a combination of both nesterone and testosterone. And what it does is that it circulates up to the brain, shuts down the switch to send signals down to the testicles to produce sperm. It's a very similar mechanism to what we see with female contraception, whereby hormones that you take also shut down switches to activate ovulation.
Right. So yeah, it seems like very similar kind of stuff, and that's a really exciting idea that there would be something as easy as just the application of the gel on the shoulders. That seems very non-invasive. It sounds like you guys are doing some awesome work. So I'll move on to my next question.
Sure.
You asked about men's passive rejection of contraception based off their belief that contraception maybe isn't their place. So how can men get more involved in the conversation around contraception, specifically their own, and do you have any ideas of prompts that they can use when they go into their GP and talk to their doctor about these things?
Wow, it's a lot of questions in one. Yeah, so this idea of passive rejection, right? It's kind of this idea that men don't think it's their job to engage in these questions of, should I be asking for a contraception? Is preventing pregnancy my job? And the answer is yes, they absolutely should. But the problem is not just as easy as, oh, men don't want to do it, right? In fact, we haven't created spaces for men to talk about contraception. And if you think about the way that we teach sex ed, a lot of people who I talk to often will tell me that, when it came time to talk about, birth control or contraceptives, they separated the young boys and the young girls, and they did not talk to them about contraceptive methods. And so if men grow up thinking that this is not their business and that this is something that is women's business only, and if men aren't educated about the subtleties of contraception, right, that not all contraceptive methods are perfect, then they may not understand the implications about needs for abortion when contraception fails. And I think that's also very important too. But ultimately, right, it's not just about men not wanting to, but also about the systems that we work in that prevent men from demanding more, thinking that this is a space that they can enter. When men go to primary care, appointments with our doctors, are they talking about, when they might want to have a kid next, right? If they ever want to have kids at all, these conversations don't commonly come up. And I find that problematic, right? Because again, we're asking women these questions and we are making women feel as if they are solely responsible for it. So until we are able to diversify the number of people or the kinds of people who are engaging these conversations, it's never going to feel like it's appropriate for men to demand male contraception.
Okay, so would that start at maybe a sex ed level or talking to general practitioners about bringing these things up in their appointments with the men that they're meeting with?
It's all levels. It's all levels, right? I would never say it's like a single point. The conversation should begin always. And what's most interesting actually about my trials, right, is that I also do interviews with individuals who've been part of the trials to understand, what brought you into this, right? This is an experimental drug. There's a risk of pregnancy. What made you think it was valuable? And oftentimes, what I hear about is men talking about their experiences, hearing about their female partners' contraceptive journeys. As you probably know, most individuals who use contraception never find the perfect method of the perfect method first. They'll probably go through, pills, patches, rings, maybe an IUD, and that might switch over time. And along that journey, if the male partner is able to see that and see how difficult it is to get appointments, how hard it can be to get your prescription, the cost that may come from obtaining contraception, and in the worst case scenario, complications from contraception, then in those cases, they might be more sensitized to this desire to do something about it, right? And that's the most common thing I find among the individuals who I interview who are part of these trials is that they want to do something that can take the burden off of their female partner.
Wonderful. That is really lovely to hear. Okay, so we've talked about the science. I want to also move on to the cultural element when we talk about male birth control. Anecdotally, just sperm count has been tied to masculinity and its social construct. So, what might a more modern definition of masculinity be if we were to dismantle that idea?
Yeah. Um, the use of contraception, right, or the engagement in any kind of family planning is often loaded from a gender standpoint, right? We hear arguments about men not wanting to be part of these decisions because maybe they're considered like in the woman's sphere or feminine, and therefore conventional masculinity would have been kind of reject that, right? What I would argue regarding sperm count is that masculinity pre-existed sperm count, right? We couldn't count sperm, way back when we were like competing among different men from a masculinity hierarchy standpoint. And so what that tells you is that the association of sperm count and masculinity is a complete social construct. We determined that, right? Someone attached sperm count to someone's masculinity because they wanted to seem superior to the other person, right? Which is what masculinity is, right? Masculinity is this ever-changing definition that helps, one male feel like they are better than another in order to establish some kind of dominant hierarchical system. And so what I would argue is that what we need to do with masculinity is create different narratives. And to me, the most, contemporary and progressive definition of masculinity is one that allows you to care for the individuals around you.
Yeah, I love that. I think that is, like you said, very contemporary and very progressive. And thank you for elucidating on that. Okay, so another question for you. Societally, we focus on how women's fertility decreases with age, but can you illustrate at what age men's fertility begins to decline and what effect that might have on birth outcomes?
Yeah. I think part of the issue is that we, haven't really done a lot of studies on men's, fertility. We often focus on, what are the female causes of, infertility. But actually, if you were to ask most endocrinologists, they would tell you that there's a male factor that accounts for about a third of cases of infertility. But why that is, people have not put enough, either effort or, financial resources into finding out. But nowadays, what we're finding out more and more is that men's age does have a contribution to, fertility outcomes. And actually, there are some surveys that are done nationally called the National Survey of Family Growth. And what we've learned from these surveys is that men who reach the age of 50, no matter how young their female partner is, are more likely to have pregnancies that end in a miscarriage. So it's really unfair to just blame it on the female partner.
Okay. And we also, lately in politics, we've had the fall of Roe v. Wade. And so people have been talking more and more about the possibility of getting vasectomies. Can you walk us through what a vasectomy is and what are some of the pros and cons of that method of contraception?
Totally. Actually, vasectomy is one of my favorite topics as an OBGYN because I'll often ask my female patients who are asking me, I'm considering getting my tubes tied. What do you think? My first question is, have you asked your partner about tying his tubes? And the reason why I ask is that vasectomy is one of the most effective methods of permanent contraception that exists. It is more likely to succeed than female tubal ligation. It is more cost effective. It is safer. You can imagine that for female tubal ligation, you have to do a laparoscopic surgery. So that's kind of like 1, 2, or 3 incisions, in the belly. Whereas for a man, right, the incision is outside the body. And the recovery time is a lot less. There's no need for an operating room. So for all those reasons, if I can, introduce the idea of vasectomy to a couple who are done having kids, then I'll do exactly that. I can't tell you the number of individuals who I talk to who will tell me, "Oh, my husband wouldn't do that," when in fact they've actually just never asked the question, right? I'll ask them, "Did you actually ask and have that conversation?" Versus, "Are you making some kind of assumption about what he'll feel?" Whereas if he actually knew that this was actually something that he could do that could support her, then it'd be a different story, right? But the way a vasectomy works, which is what your original question was, is that men can go to the office, see a urologist, a family medicine doctor, or a general surgeon, and they inject some kind of local anesthesia, kind of like what you might get at the dentist, into the scrotum overlying the vas deferens. They make a small hole. Some will even do it without any kind of scalpel at all. They can just use little scissors to kind of open a small hole in the scrotum, and they bring the vas deferens up. They will, cut it, tie it, burn one end, and then bury another end, and then that's it. They'll do it for the other side as well, but that's it. 3 months later, or a couple weeks later, they'll do a check of the sperm to make sure that there is no sperm left. And once that is confirmed, they're good to go.
Okay. How reversible are they, and would you recommend them for men who are who want to have children in the future?
Yeah, it's a good question. It's controversial regarding how reversible they truly are. In general, when I counsel about any kind of vasectomy or tubal ligation, the first thing I ascertain is how comfortable the patient is with this method being permanent. And I'll often tell my patients, look, if you could imagine yourself or who you were 10 years ago versus who you are now, is that the same, right? You never really know what happens in 10 years, and that can really impact your desire to, have a child or not have a child. And we actually do know that men are probably more likely to regret their vasectomies than, women are. And that could be related to having another relationship or, whatever else along the way. So I do kind of caution the use of vasectomy with intent to reverse it later. And again, that's why I'm such a proponent of developing new methods of male contraception to ensure that we have reversible methods. That being said, I do want folks to know actually that one of the first human implantations of a gel that gets injected into the vas deferens that's aimed to be reversible was actually done this week. So some cool stuff happening in the pipeline.
That's awesome. And out of curiosity, I know that you've mentioned that for those who are considering having children in the future to maybe consider not having a vasectomy, is there a possibility of, having your sperm put in a sperm bank if you decide that you do want to go the vasectomy route?
Yeah, absolutely. I mean, those are all options, right? Where someone can bank their sperm and then choose to use that sperm later. However, the concern is cost, right?
Right.
Is it worth that cost? Is it covered by your insurance? Is it available to everybody? And the answer is often no. So that, to some extent, might be something valuable to consider from like a reproductive policy standpoint, right? If we truly want individuals to be able to exercise their reproductive autonomy, then we need to make sure that insurance will cover it.
Right. Yeah, absolutely. Okay, well, I just have one more question for you, and then I'll open it up to any questions or any final thoughts that you might have. But how might, add now the reversal of Roe versus Wade? We did have some states codify abortion rights into their, state constitution as of a couple of days ago, which is very exciting. So how can men show up for women in their battle for reproductive freedom?
Yeah, I hate that it has come to this. to get men to kind of be more vocal, because actually restrictions to abortion have been happening for, decades now. Even after, Roe v. Wade was initially, passed, we still had states trying to restrict when abortion could happen, or who would allow it to happen. And we didn't have, enough men kind of saying that they, benefit from abortion. And we absolutely do know that men benefit from abortion. We know that, 1 in 4 women by the age of, 45 will have had an abortion. And we know that at least 80% of those women talk to men or their male partners about abortion. So it's not as if men don't know that it happens. And it's not as if, all these men are in disagreement about the abortion. So, and we also have studies that show that when, men are able to, have a desired abortion, they tend to be more likely to complete their, higher education. So, men certainly do benefit from abortion, and that needs to be known. And again, it goes back to to the issue of lack of spaces for discussion, lack of spaces for men to talk about abortion, the stigma about abortion preventing men from talking with each other about it. And so when you don't have these conversations, you end up with more like these echo chambers where, men become radicalized and become anti-abortion. And those are the men who go into politics. And I find that to be a very problematic trend. So in terms of a solution, what we need to do is encourage men to talk about it, either with their doctors, their partners, and really normalize the value of reproductive rights.
Absolutely. That is all so fascinating. I'm going to leave it up to if anyone has any questions for Dr. Brian before he goes. You are welcome to do so now. And while we wait to see if there are any questions, Dr. Brian, do you have any closing thoughts for us?
Sorry, what was your questions?
I was wondering if anyone had any questions in our audience. Not if you had any closing remarks for us on the work that you're doing and what you can see happening in the near future.
Yeah, totally. So my work with eMERGE, which is an acronym for Expanding Male Engagement in Reproductive and Gender Equity. Y'all can check out the website. The little logo actually is a seahorse, and the seahorse is a symbol of men being able to carry a pregnancy or take on a conventionally female role. And what I'm trying to show there in this work is that every single women's health topic, whether that be trying to get pregnant, trying to avoid becoming pregnant, trying to avoid STDs, avoid cervical cancer, get HPV vaccines, these are all relevant to men. However, our medical system has never considered men as a consumer of these or a consumer of these services, right? So if you think about the HPV vaccine, it was originally made to prevent cervical cancer in women. However, no one ever thought to market it to male partners, thinking that, hey, here's an opportunity for us to eradicate HPV in the same way that we're eradicating polio. Why not eradicate the virus in individuals who could transmit it? But you can see that because of the gender siloing of HPV and cervical cancer, that it took about a decade before insurance companies were willing to approve of this vaccine in young men. So the work of the eMERGE Lab is aimed at just demonstrating all of those gender-based disparities. Another example is emergency contraception, whereby men face a lot of pushback in trying to obtain emergency contraception for their partners. And we actually just wrote a commentary about genetic testing too. So individuals who are at genetic risk of passing a disease down to their babies. We have insurance that covers that for women, but we don't have that for men. And what that means is that sometimes some pregnancies will have to go through, additional testing, meaning like a needle in the belly, with the risk that is entailed by that, because the male partner, couldn't get tested. So there's a lot there that has to do with the way we've structured the medical system, um, that in a way that kind of excludes or overlooks the role of men. And then male contraception is just another example of that.
Mm. So is it that we have feminists like you who are in charge of these sections of the medical field, or are these things that we can talk to Congress members about, maybe passing laws for inclusion in healthcare? What are your thoughts on that?
Yeah, I mean, there, there, I would say that I'm not in charge yet,
No.
but I would say with more funding, and if you want to fund my research,
Yeah.
that certainly could change. But I do think that actually lobbying is very, very helpful. One example that of lobbying that could have been done better actually is with the Affordable Care Act. So the Affordable Care Act, I'm not sure if your audience knows, right, is ensures that all contraceptive methods are covered by insurance, right? So, and that applies for female users, but actually not men. So, if a woman wants to get her tubes tied, that should be a covered benefit by her insurance provider. Um, but if a man wants to do the same with the same insurance, the vasectomy does not have to be covered. And so that's just an example of some of that, gender siloed disparity that is in existence not only in the medical field, but also in public policy as well. Um, and that kind of goes back to this idea of if you don't educate men from a very young age, they become politicians.
Wow, that is a great last statement to end on. I just want to thank you again so much for your time. This has been I've learned so much over the course of our conversation, and I hope that everyone who's been watching has as well. So thank you so much.
Cool. All right. Thank you very much. Take care.
You too. Bye, Brian.
All right. Bye bye.